In this presentation, we will examine the thyroid gland. The rest of the examination of the head, neck, and lymph nodes is covered under the general examination procedure. Dr. Safa, how do you approach the examination of the thyroid gland?
Well, Andreas, with the thyroid gland, the need to evaluate its function doesn't often come from a visible presentation or clinical observation. Instead, it often comes from a patient's symptoms or findings from their case history.
Okay, can you perhaps elaborate a bit further what you mean by this?
An overactive thyroid generally causes accelerated metabolic processes. These can manifest as restlessness and irritability, tremor of the hands, weight loss with an increased appetite, palpitations, sweating, diarrhea, menstrual changes. Periods can become quite light or infrequent, shortness of breath, skin problems such as hair thinning and itchiness, feeling quite tired, muscle weakness, and physical signs as well, such as having a swelling, a goiter, or eye changes such as exophthalmos. And the features of an underactive thyroid gland, hypothyroidism, a patient can present with tiredness, lethargy, and intolerance to cold. They could have dry skin and hair loss. There may be slowing of intellectual activity, e.g. poor memory or difficulty concentrating. They may be constipated, have a decreased appetite, weight gain. The voice may change to become deeper and hoarser. Women may present with menorrhagia or oligomenorrhea or amenorrhea. There may be impaired hearing due to fluid in the middle ear, and other signs include a reduced libido, pleural effusions.
So please, could you now show us how do you start this examination?
Mrs. Smith, I'd like to examine your thyroid gland, which is in your neck. So can you sit up for me?
Yeah.
Thank you.
When examining the thyroid gland, first observe the contours of the patient's neck from the front and in profile. Look for gross enlargement of the thyroid, asymmetry, and nodularity. Then palpate the thyroid by standing behind or in front of the patient. Reassure your patient whilst you're carrying out this procedure and explain where you will be placing your hands.
I'm going to examine your neck from behind.
Okay.
Tell me if I cause you any pain.
Adopt a systematic approach. Start superiorly, that is from the sides of the cricoid cartilage, just below the thyroid cartilage. Progress your way down, continuing to palpate over the sides of the trachea. Then continue further down until you reach the sternal notch and the sternoclavicular joints. This marks the thoracic inlet. We suggest you use the pads of your second and third fingers applied lightly and obliquely over the trachea. Use a slow, gentle rolling motion. Ensure you palpate between the trachea and the sternocleidomastoid muscle. Feel for overall enlargement, the presence of masses, both hard and soft, and try to establish whether they are mobile or tethered to the neighboring structures. A goiter is easily movable, slightly firm, and usually non-tender. If the patient reports any pain or tenderness during palpation, they may be suffering from thyroiditis. Another method to evaluate the thyroid gland is by asking the patient to swallow. This is best achieved by asking them to take a sip of water. The ascent and subsequent descent of the larynx and trachea helps you to distinguish between the superficial soft tissues from the underlying hard structures.
Mrs. Smith, what I'd like to do is take a sip of water, keep it in your mouth, and then swallow when I ask you to.
Okay.
Thank you.
First, just observe the thyroid gland as the patient swallows some water. Observing the neck as they swallow may help you to accentuate the presence of an enlarged thyroid. The thyroid may be seen to ascend when the patient swallows. The second time you repeat this technique, have your fingers lightly placed over the sides of the gland whilst they swallow the water.
We're going to do that again, but this time with me feeling your neck. Swallow. Thank you.
An enlarged thyroid will move under your fingers as the patient swallows. Feel for the two lobes, any enlargement or any evidence of nodules. Afterwards, ask the patient if they had any difficulty or discomfort when they swallowed.
Do you have any
Note if the patient experiences any discomfort when their neck is taken into extension. During these procedures, be on the lookout for any visible or palpable thrills over the thyroid. Is the thyroid gland always palpable in a healthy patient?
It is more easy to palpate the lobes of the thyroid in a slender patient. However, it's not always possible to palpate the isthmus unless the thyroid gland is enlarged.
The thyroid gland may be auscultated for the presence of vascular bruit. Use the bell of the stethoscope. During this procedure, ask the patient to breathe gently with their mouth open.
What I'd like you to do is breathe very gently with your mouth open, please.
Alternatively, ask the patient to hold their breath for a few moments whilst you auscultate. Listen on both sides of the gland. A systolic bruit can be a manifestation of thyrotoxicosis or due to other vascular obstructions. A vascular bruit may be further evaluated using a Doppler. If you suspect enlarged thyroid, compromised thoracic inlet, or an intrathoracic mass, then perform Pemberton's maneuver.
Mrs. Smith, can I ask you to raise your arms above your head and just keep them there for a few seconds? Thank you.
Pemberton's sign is facial flushing, distended superficial veins of the neck and head, elevated jugular venous pressure, and aspiratory stridor when the patient is asked to elevate both arms above their head. There is a whole array of signs and symptoms, especially when metabolism is significantly altered. Generally, though, hyperthyroidism or overactive thyroid is more commonly associated with tachycardia, loose bowels, proximal muscle weakness, and restlessness. In contrast, hypothyroidism often results in symptoms of lethargy, constipation, dry skin, depression, and poor concentration. Afsana, when do you refer someone for further investigations?
The first investigation you can do in primary care is, of course, the thyroid function tests, as well as some autoimmune tests. You can refer the patient if you detect an enlargement, tenderness, any particular nodules or masses, if there's evidence of inflammation or signs of metabolic disturbances.
Bear in mind that physical examination may not reveal abnormalities even when pathology might be present. Quite often, the decision to refer may be based on case history alone.